Hispanics in Washington are far more likely to be infected with COVID-19. We are getting early information that reveals they are far less likely to have gotten a vaccine to date. Despite calls for racial equity and COVID response, the racial disparities are drastic. And Q13's Simone Del Rosario is asking questions of the state's top health officials today. So, Simone, what are you learning?
Jamie, the state just has not done enough to create equity in this vaccination response. In fact, health officials say that the systems that are in place are just perpetuating the problems that have long existed, which are continuing to put minority communities at greater risk during this pandemic. Hispanics are the group that is most affected by this. They make up about 13% of the state population, but 32% of the state's cases. And then look at this. To date, they've received just about 5% of the vaccine doses, which is obviously far less than their share of the population. Black and multiracial people are also disproportionately represented in the state.
There are so many access barriers that we've been hearing about from community leaders and partners over and over again, including language access, technology access barriers, transportation barriers, et cetera. And we know that even within our MaxVax sites, we can integrate an equity lens, for example, by starting to reserve appointments for phone-based scheduling.
Well, even in places like King County, where the county specifically targeted higher minority areas of Kent and Auburn for its mass vaccination sites, an analysis I did of county data showed that people who live in Auburn, Kent, Federal Way, they are less likely to have gotten a vaccine than people living anywhere else in the county. Now, the state says it does have a plan to fix these growing disparities. That includes leaning heavily on trusted community groups and community providers. But providers that I've spoken to that predominantly serve minority communities say they have the people who are willing to get the vaccine. What they don't have from the state is vaccine doses, and therein lies another problem the state is facing. I'm told today that this week the state received just about half of the requested doses of vaccine from the federal government. In Seattle, I'm Simone Del Rosario, Q13 News.
All right, Simone.